My presentation was over Scapho Lunate Dissociation. The anatomy for this is the Scapho Lunate interosseous ligament, which has three components, which is the dorsal, proximal, and volar components, the scaphoid carpal bone, and the lunate carpal bone. Pathology, this is a rotary subluxation of the scaphoid, abnormal orientation of the scaphoid relative to the lunate, and this is usually palmar flexion of the scaphoid and dorsiflexion of the lunate. Mechanism of injury would be falling on an outstretched hand or wrist extension with ulnar deviation. Signs and symptoms can be pain in the anatomical snuff box, stiffness, weakness, numbness, spasms through the hand, or a click or pain on the dorso-radial aspect of the wrist. Special tests can be the Watson test or Murphy sign. The Watson test is to take the person into ulnar deviation. If there's pain, then that's positive. The Murphy sign is usually your third metacarpal phalangeal joint is higher than the rest of them. So if your knuckles are even, then you will usually have a dislocation of the lunate. Predisposing factors can be age, a previous hand or wrist fracture, or a previous subluxation or dislocation of the wrist. Recognition and differential diagnosis. Differential diagnosis can be a scaphoid fracture, a scaphoid impaction syndrome, which is SIS, dorsal ganglion cyst, or a paralunate dislocation. Management and treatment will be rest, immobilize with a splinter cast, police, NSAIDs. For surgery, it would be an arthroscopy or they would put pins in your hand. And for imaging, you would get an X-ray, CT scan, or an MRI. Referral and immobilization, you would refer them to an orthopedic physician or a surgeon, and then you would splint or cast them for 2 to 6 weeks. Prevention of this, it basically is just going to be like teaching an athlete how to fall correctly and educating them to not fall on an outstretched hand. Mulligan Technique is manipulation of the provocative movement, so an anterior or posterior glide or a medial or lateral glide. This is my peacock. References.